Okay. So, hello everyone. Good morning. I'm in New York and welcome to Trust for Youth and Child Leadership or TYCL side event as part of the 2021 United Nations High Level Political Forum. My name is Karthika and I will be the moderator for today's side event. And thank you for joining us again today. We will discuss about COVID-19 and youth mental health recovery in the global south, a way forward for local action. Just before we start, I would like to give a quick review of today's agenda. We will start with an opening remark from TYCL's founder director, followed by presentations from today's speakers. And then there will be a closing remarks by a youth representative from Africa. Then for all of you who have joined us today, we will have a question and answer session at the end of the presentation. And just a little bit about Zoom recording and visibility. For today's side event, it will be recorded and the recording will also be available on TYCL YouTube channel. I'm sharing with you the YouTube channel link so that if you want to check out the recording later, you can just go to this link. And then also while the speakers are presenting, participants are welcome. If you want to ask questions, you can use this format that I'm sharing in the comment section as well, so that while presenting, if you have questions, we can just gather your questions and answer at the end of today's side event. And also, after the question and answer session, we will give you time if you want to network with other participants, also today's speakers, you can just connect with them at the end of this Zoom meeting. Okay, without further ado, I would like to introduce you to TYCL founder, Dr. Siva Mathiyazhagan. He's also a social work practitioner and researcher. His research and practice center around social work technology, youth, and indigenous communities. I would like to invite Dr. Mathiyazhagan to please deliver your opening remarks.
Thank you, Karthika, and hello, everyone, and vanakkam, and that's my mother tongue. And good morning and good evening and good afternoon. People are joining from different parts of the life as well as different walks of the life and different age groups. And thank you all joining today, and welcome to the United Nations High Level Political Forum 2021 on sustainable and resilient recovery from COVID-19 pandemic. Normally, we used to have a high-level political forum in the headquarters in New York, inside, and were a very limited access to the UN. Now it's opened up, since it is virtual, it's opened up for anyone who could participate and contribute to this cause. And I'm so glad that you all joined today, and grateful to connect the youth and stakeholders from various parts of the world, particularly from the global south. There are very, very limited conversations about youth mental health and global south. The virtual panel discussion today is going to focus on the COVID-19 and the youth mental health recovery in global south, a way forward for local action. And so it's my great pleasure to welcome all our panelists from India, Kenya, Colombia, and France, especially. And I hope Dr. Susan Gitau will join soon as a faculty of counseling psychology from African Nazarene University, Kenya. And I also welcome Professor Carolina Giraldo, faculty of social work, and a student leader, Alejandra Coesbon from University of Santiago de Cali, Colombia. Mr. Rasaiya, associate director of TYCL-India, and a counseling psychologist from Pondicherry, India, and Ms. Julie Gagnon from France, public health researcher, and she's been very closely working with us in UN NGO Committee on Mental Health. And I'm happy to welcome my professors and partners, colleagues from India, and today's moderator, Karthika from Indonesia and New York, and the co-organizer of the event, Dawood from Egypt, and all the participants from across the globe. Welcome you all once again to our discussion. And right after the COVID-19 was declared as a pandemic, the mental health issues spiked, due to the loss of job, loss of loved ones, and the lack of social lives. Prior to COVID-19, 1 out of every 5 young people in the world was suffering from mental health issues. These are often unnoticed or unreported. Youth suicide is the second leading cause of death among young people aged between 15 to 19. Particularly, it is high in the global south, though majority of the world population lives in the global south, which has received a very minimal share of global mental health resources. In many of these countries, COVID-19 surge has devastated lives and livelihoods. It will have a long-term impact on the youth and their mental health. It is clear that the healthcare system of low and middle income countries are incapable of providing sufficient mental health care and support to young people in their respective countries. Due to lack of resources and political will, the mental health services are limited and it is not available and accessible to everyone, and particularly youth in the bottom of the social pyramid. There is a greater need for a long-term and a resilient recovery from the COVID-19 pandemic, particularly in low and middle-income countries. It is essential that countries in the global south need to develop effective national policies, action plans, and resource allocations to address the pandemic and its related mental health consequences on young people. This panel discussion today will bring a collective knowledge and possible suggestions from various parts of the global south to address policy gaps at the global and national levels. And TYCL will continue to work with the UN systems and member state to address mental health policy gaps and press the respective governments and mission offices to develop an action plans and national action plan for youth mental health with necessary resource allocations. So there is always a challenge in terms of going and asking for policy changes. There's a lack of empirical evidences and lack of clarity about it. So we've been continue to work with the member states and are reviewing the member state VNRs and trying to understand what was their priority on mental health, particularly to the young people. When what we noticed from the results of our research is that very limited number of countries have mentioned the mental health in their policy documents, and most of the countries just ignore the mental health. But when it comes to the youth, there is no mention of youth in the most of their VNRs and the voluntary reports. So with this statement and commitment, I would really hope that this conversation will bring us a lot more perspectives and ideas for our policy-based advocacy at the UN level as well as the national level. I hope this government listen to us and try to have a more youth inclusive policies and necessary resource allocations. And once again, I welcome you all to this great panel discussion and thank you for joining us, and over to Karthika. Thank you.
Thank you, Dr. Siva, for your opening remarks. And we're supposed to have Dr. Susan Gitau as our first speaker today. However, she has not been able to make it here with us today. So I would like to introduce you to our next speaker, who is a professor of social work at University Santiago de Cali in Colombia, Professor Carolina Giraldo. She has academic interest in family care, migration, and public health, and is currently working on a research design that investigates the social organization of care in the context of migration crisis and health emergency due to COVID-19. Her experience includes working on projects and research in the area of family support, peace agreement, and social networks. And joining Professor Giraldo is Alejandra Quisabon, the student leader of the Hotbed Research for the Family and Society of the Faculty of Communication and Advertising of the University Santiago de Cali. Her academic projects and interests focus in the area of mental health, public policy, family, society, social crisis, democracy, and intervention with families and teenagers. So please, everyone, join me in welcoming Professor Giraldo and Alejandra. Professor Giraldo, you're muted. Okay, it's good now. Thank you.
Okay, thank you to you. Please, can give me one moment because we have returned in the audio. Please, one moment.
No worries. So while waiting for Professor Giraldo, I would like to remind everyone while our speaker is presenting, if you have any question, you can just drop the question in the chat box using this format that I'm sharing with you. And we will answer your questions one by one at the end of the presentation.
So today's presentation, all our speakers are going to be from Global South, and except Julie, and no one has English as a first language, but it's unfortunate that we are having the whole panel discussion in English because of this colonial impact on every one of us. So the speaker's first language is not English, so make sure that particularly for Professor Carolina and Alejandra's first language is Spanish, and Julie's first language is French, and Rasaiya's first language is Tamil. So we are going to have a entire conversation in English. If anyone would like to express anything in your mother tongue, and please do express it. That's okay for us, and we'll try to do some translations, and that's also all right. And we want to create much more inclusive space in terms of language and try to create more access to more people. So let's.
Okay. Okay. We are ready, but please give me your slide. Are you looking at our presentation?
Yes.
Okay. Okay, thank you. Alejandra, es que no tengo quien nos ayude. Okay, good morning. It's a pleasure to share with you this space on behalf of the Family and Society Hotbed Research in the Santiago de Cali University, which puedes quitar ese recuadro, which brings together young people with training interests in the field of social research and current problems of the society.
Okay, within the framework of our research activities, we recently inaugurated a space for open discussion with local actors, which we entitled Conversations from the Local, and which on this occasion had more than 16 participants as protagonists, mostly children and young people between 5 years and 25 years from different parts of Colombia, whom we summoned to talk about their emotions and experiences during the whole emergency, with the intention of replicating their voices in this scenario and presenting at the closing 3 proposals for high-level politics.
Okay, Alejandra, as the leading student of the Hotbed Research, will be in charge of representing the voices of the young people who from urban and rural areas in these municipalities of San Stanislao de Coxca, Bolivar, Bolivar State, Quinchía, Risaralda, El Tambo, Cauca, Puerto Salgar, Cundinamarca, Jamundí in the Valle, and in the city of Cali, participate in our initiative Conversations from the Local.
Okay, the discussion space was very interesting throughout scenarios, video conferencing, and by sending a video clip for those who did not have the opportunity to join us in real time. But in both cases, the young people participated with great enthusiasm because they highly value the opportunity for their proposals. And so the fact is having impact with global south. Please give us a moment.
Poquito más grande. Okay, in the statistical data, to arrive at the proposal, we consider it important to start from the available data. So we take as the reference some official figures that are available for the consultation through the Integrated Information System of Social Protection, CISPRO, and the National Institute of Legal Medicine and Forensic Sciences at the National Institute of Health. Está acá. La presentación donde dice estadística. Esta me le bajas ahí, gracias. Listo. Okay, regarding psychological development disorders in children and adolescents, we see a considerable increase in the epidemiological registry between 2009 or 2009 and 2018, where the largest number of cases are in the range of 5 to 9, which in those 9 years increased 7 and 2 times, and in the range of the 10 to 14 years, the increased ratio in 2018 was 5.4 times compared to 2009. This increase is in the registry may indicate that there may be a greater willingness to the mental health services as a result of the stigmatization campaigns of state services. But it may also suggest that children and young people are increasingly exposed to risk factors.
Yeah.
Okay.
Professor Giraldo, there is
in this, puedes ponerlo más pequeño.
Yeah, thank you.
Okay. Okay. Okay, ellos lo están presentando. Préstame entonces el computador más pequeño. Okay, please, one moment. Este de acá.
Professor Giraldo, I think this is okay. Now we can see your presentation.
Necesito ver este.
I'm sharing the screen. The earlier one, it was not. I was not able to move the screen because it was from website. But right now I can help her on this. I downloaded it.
Okay. Okay, we have a little. Okay, okay. Now, podemos bajarle un poco, por favor. Okay, in the first, no tanto. Solo lo que dice naranja. Eso. Okay. In the first, in the last, we were looking only the first part. Now in this, we have the depressive event. And the depressive events are mainly concentrated between the age 10 to 20. No, no me lo bajes más. To 24. In the case of moderate events, the range from 10 to 14 years is the one with the greatest increase, with a ratio of 24 times more in 2018 than in 2009. In severe depressive events without psychotic symptoms, this relationship in the range of the 15 to 19 years reached an increase of 5.7 times, while severe events with psychotic symptoms fell in the range of the 5 to 9 years. It did not vary between 10 and 14, while between 15 and 19 years it doubled, and between 20 to 24 years, the growth approached 50%. And this could be explained by greater exposure to the use of the psychoactive substances and previous depressive events, but moderate and severe without a psychotic event. This all implies that children and young people who are cared for by this diagnosis are more likely to develop events associated with psychotic symptoms from pre-adolescence and with greater acuity in the range of the 15 to 10 years. In the case 5 to 10 years. In the case of the suicide attempt, next please. Thank you. In the suicide attempt in 2018, the figures indicate that women almost double those of men. However, the information that does not disaggregate age according to sex, and therefore no differences in behavior could be inferred according to sex in children and young. The age group with the highest suicide attempts is between 15 and 19 years old, which coincides with the proportions of this age group compared to consummated suicide. Regarding, next please, in the presentation. Okay. No, okay, after, yes, thank you. Quedaron cambiadas. Okay, I was talking about the other, excuse me, I am a little nervous. Regarding complete suicide, it's alarming that records are included from the range of 4 to 4 years, with a considerable increase from 5 to 14 years. The difference between men and women becomes disproportionate after the age of 15. From the which it can be inferred that the adolescent pregnancy may explain why women from this age go to a lesser extent to commit suicide due to parenting responsibilities and careful, while young men face greater difficulties in developing their human potential due to factors such as a greater stigmatization of diverse sexual orientations, barriers to access to education and formal jobs, as well as precarious living conditions. Unlike women, we cannot infer much about the relationship between men's reproductive dynamics and suicide because information systems has not this information. Listo, Aleja.
Okay, before the health emergency to COVID-19, since 2013, our country has had the primary healthcare law gave rise to 1918, national mental health policy that introduced some strategies to guide promotion programs that strengthen individual psychosocial skills and collective social cohesion, and manage healthy, resilient protective environments. Also, guide prevention programs that articulate mental health about systems and services with community-based devices, and strengthen the response of health services with a focus on primary care in health that promote community-based rehabilitation and social inclusion, and optimize information and some knowledge management system, as well as a sectoral and intersectoral articulation that achieves the adoption of specialized care and first aid in mental health. For its part, the Ministry of Health and Social Protection in 2016 present the RIAS comprehensive care routes, which are coordinated, complementary, and effective actions to guarantee the right to the health from political process, plans, programs, projects, some strategies and services which are required by patients, families, and communities for health promotion, disease prevention, diagnosis, treatment, rehabilitation, and palliative care. Among them, the disorder associated with use of ESPA, mainly among groups and populations that share conditions or risks that can be affected health and their well-being. Since the pandemic, the government has implemented a hotline for information on the coronavirus, and in option cases of danger of violence can be reported, and psychosocial support that also can be assessed to face the mental health symptoms that have arisen in the context of pandemic. Likewise, from different social programs, telephone support was implemented where the institutions provide remote psychosocial assistance to their benefits. That's perfect.
Okay.
Okay.
Bájale un poquito, por favor, el de Word.
We are looking at our
Bájale
presentation.
un poquito. Bájale un poquito más donde está naranja. Okay. Another of the government's initiatives is a mobile application where mental health teleconsultations can be scheduled only that the professionals who attend do so as volunteers. And this implies that there is not enough and timely coverage that has generated rejection by the users. Citizens who have wanted to use these resources, since waiting times are around 2 months. Other actions have to do with the orientation growth of the management of emotions that promote the mitigation of the risk of suicide, the overcoming of crisis based on support guides for good living in times of pandemic. Guide support materials and other resources are very valuable, but institutional interventions are generally limited to an informational role, and little is achieved with regard to sensitization, awareness, and concrete action, which indicates that it is necessary to continue reporting, but we should not stop here. The next, please, the next. Listo, Aleja, ahí te haces allá. Okay.
Okay, guys, regarding the emotions and feelings that are in the pandemic, the young people share their experiences that we want to share with you as they express it in their own words. Like, I feel bad because fears they tell us you won't study. I don't know, I say, how's that? Where are the friends? So the emotion of young people and children have a change some drastic because they tell us that they feel angry about everything and got lazy, get more lazier than any moment. So that told us Santiago Spina of 11 years. And in the other hand, we have Laura Martinez, from 18 years old, that she told us that this pandemic was very hard for her because she felt with more stress than normal. She feel anxious. So this moment about her feelings, sorry, it's about or it's because of virtual classes. So that was very hard for her. On the other hand, we have José Alexander, de 12 años, of 12 years, sorry. The pandemic for him was very hard because he has 4 brothers for a single one cell phone. So they didn't understand the homeworks and guides that college sent to them. So these guys feel stressful, they feel anxious, they feel bored, they feel sad, they feel with fear. So that's what we want to share with you. The next presentation, please. Okay, thank you. And there is something important.
No, la próxima en la que están es
the experiences.
Ya tenemos un eco en esta sala.
We have an echo. Please give us a moment.
Listo. Is it better now with the sound? Can you hear us better now?
Hi, Professor. There is still some echo. If you could reduce that a little bit more, that would be better.
Okay. No. Sí, lo de las experiencias.
Okay, to continue, I want to share some experiences, pandemic experiences. And we have that, for example, Leo of 11 years, he lost his uncles and some families, relatives. So this is a great important that we share with you because we have conflicts between inside the homes, inside their houses. So also they have no internet access or devices as Jose Alexander. There's a lone child in home for a long time during the day. So that's because they feel alone and kind of forgotten. So that is very important because we want to make decisions about how the experiences of our children and our young people. And because of the pandemic, so the guys have to be in home. So the increase in sedentarism because they have nothing to do. So Also, there's difficulty for learning at home, so the virtual classes are so difficult, and that's what we have to see about our people and young people. And also, something very important is that loss of parental job, and that can be relationating with the pandemic, because our parents lost his jobs, and they probably have no food to share with her children. So that is an important problem that we have to watch. Also, facing with probably ignore mental health issues, and I think that is something very important, because we have ignoring our compromise with our mental health of our young people. So it's very important to attend this experience that is located in the global south.
The next, please. About the proposal for the global action, we have the proposals that save the children and young people, and three proposals from us. The young people drew attention to the misuse use of force in the demonstrations of social protest, as they identified that the police abuses were mainly extended against the young people. They consider that it is essential to prepare for future health emergencies, since the precedent that COVID-19 is setting opens the possibility of a new pandemics, which forces us to anticipate critical situations that may arise from drastic measures such as isolation, physical distancing, and the predominance of forms of remote relationships. And the young people are clear that the response of health services must increase their coverage, as well as eliminate access barriers. But we also consider it important to note that it is essential to rethink health systems based on insurance models that market health services, and they precisely create barriers to access. The proposals that made most echo among young people were those related to the implementation of sports, artistics, and cultural programs as a strategy for the promotion and prevention of mental health problems. The strengthening of empathy as a matter of public interest was a great demand of the young people who participated in conversations from the local, because during the protest, it became clear that we need to work more on this value, on that value for young people. It has been heartbreaking feel under the surveillance of the forces of order, because they can easily be branded as vandals or criminals. And the voices of the young people also agreed that it's necessary to work for destigmatization for the people who consult for mental health services. Me lo bajas, por favor, el word. In the mental health services, and the importance of learning to manage our emotions, which are lifelong task. In the proposals for the global agenda, it's the next in the presentation. Baja todo el azul. Implement epidemiological surveillance systems in real time that provide information with the greatest possible disaggregation. Meanwhile, the delays in epidemiological information and the arbitrary aggregation of data make it difficult to take advantage of the wealth of primary sources, and taking into account that we must irrefutably prepare for a future that may bring us greater challenges for public health, governance, the social viability of various forms of life that depend on local context. The second, it's a global system of care that should take into account the conceptual proposal of Sarah Rasaiya on the diamond of care that indicates the co-responsibility on the family, the state, the market, and the civil social organizations. Thus, a global system of care will imply that the global basis of care is drawn as a public matter and thus incorporated into the political agenda of all governments that are interested in promoting a global development platform. From a global direction, a global system can be contextualized to the local reality from permanent spaces for dialogue where it is recognized that young people, in addition to being subjects of care, are also actors with political influence, as evidenced in the social protest for us. In South America, we have the reference of the national care system of Uruguay, and here in Colombia, the Gender Affairs Subdirector of the National Planning Department has been leading the formulation of a national care system, which is preceded by the care economy law, which included the contributions of domestic care to the indications of the national economy, to the indicators of the national economy.
Okay. It's important to consider the real relevance of targeted or selective public policies and social policies for the implementations of sustainable development programs and projects at the local level, since living conditions are fluctuating and income is often not fixed. Currently, people are subject to greater uncertainty to generate stable income.
Okay, thank you very much. We had a colophon, but we think that it's enough for now. And excuse for all these technologic and nervous problems, but thank you for giving us your attention.
Thank you so much.
Thank you, Alejandra. Go ahead, Karthika.
Thank you, Professor Giraldo and Alejandra. Due to the limitation of time, I would like to just move to the next speaker. But if you have any question for Professor Giraldo and Alejandra, you can just drop your questions in the chat box. So our next speaker is Mr. Rasaiya. He's a consultant counseling psychologist, as well as the Associate Director of TYCL-India. He holds a Master of Science degree in Applied Psychology and a diploma in Counseling and Guidance from Pondicherry University in India. His experience centers around promoting positive mental health among youth and children, and also conducting suicide prevention and community development activities with tribal and underprivileged communities in Puducherry and Tamil Nadu, India. So without further ado, I will turn the time over to you, Mr. Rasaiya. Thank you. I think you're still muted. Could you please unmute yourself? Yeah.
Thank you, Karthika. Thank you for the warm introduction. And let me share my screen. Is my screen visible?
Yes, it is. Thank you.
Okay. Thank you once again, Karthika, and each and everyone here. It's my great honor to be here in front of all the dignitaries here, especially in the higher level political forum. And I'm so glad to represent and advocate for youth mental health in India. Also, I'm so happy to introduce you all the Indian context of our topic, the COVID-19 and youth mental health recovery in India. Way forward for local action. Before getting into the topic, like I would like to share or introduce some of the relevant facts about the topic in the context of India. So India is the second highest population, which has a largest youth population, youth population as well, with the literacy rate of 77.7%, with GDP of 2.62 lakh crores in the last financial year. And with that, in addition, like the World Happiness Index, India has ranked 139 in the survey. And like with the mental health context of India, India has launched its first mental health program, National Mental Health Program, on 1982 by National Health Mission of Government of India. And the first mental health policy has been launched and published on 2014. And after a lot of improvisation, a better mental health act has been launched and came into act for on 2017. Getting into the topic, like the mental health status of India, the mental health status of India has like a lot of challenges as well as a lot of threatening factors as well. Some of these would be more than 1 lakh people die by suicide every year, which is a huge mental health threat in India. Like it is a fact which has been taken by National Crime Record Bureau in India. And there is also some other challenges the availability of mental health workers in India per 1 lakh population is only 1.93 people per 1 lakh population. And according to WHO, like World Health Organization, the economic loss due to mental health conditions between the years 2012 to 2030 is estimated to be nearly $1 trillion US. So it will be a huge loss if we don't concentrate on the mental health in India. And if we are even focusing on youth, as I said earlier, India plays a vital role in the local and global economy with the highest number of young human resources. But still, there are challenges. There is no specific youth mental health policy in India currently. Especially after the COVID-19 global pandemic, the lives and livelihood of the youth population have been severely affected, and it impacts their mental health and well-being. The global health and socio-economic factors are increasing suicidality, unemployment, the digital divide in education, and lower civic engagement as threats and challenges in the context of youth mental health. And there are a lot of challenges and threatening factors in youth mental health. Like a major threat is suicide in India. Like suicide is the second leading cause of youth mortality, as Dr. Shiva has told. And during the COVID-19 pandemic, several youth suicide cases have been reported on the local and national news outlets as well. And there are several psycho-socioeconomic factors are determining the youth suicides in India. For example, lower self-esteem, hierarchical social structure such as casteism, religionism, and economic imbalance like poverty and unemployment, interpersonal issues, and health threats are the most contributing factors for the youth suicides in India. Considering all these threats and challenges in youth mental health, there are a lot of very good practices, very good best practices are being taken by some of the NGOs, some of the organizations and institutions as well. I'm happy to present represent some of the TYCL's activities which are focusing on youth mental health and addressing some of the threats and challenges caused by the COVID-19 as well. TYCL, Trust for Youth and Child Leadership, is effectively creating a local, national, and global discussions on youth life, livelihood, and mental health. Especially the discussions, initiating discussions in the local, global, and national forums would be a important one, to make every people to think about it and speak about it, to create an awareness and sensitize people, and also to make a step towards a change. And TYCL has conducted and organized many local panel discussions, expert talks, public opinions, and poster presentations in the local language to sensitize the local people over India, especially Tamil Nadu and Puducherry region. And the national conference with the Central University of Pondicherry has been conducted in the topic of youth life, livelihood, and mental health to academically discuss about the topic. And there have been international dialogues through UN side events has been created with some of the UN ECOSOC institutions. And one another program that Youth Helpline, Puducherry Youth Helpline, which is an initiative of TYCL. It has been created, conceptualized and created on 2014. As I told earlier, India is already in a vulnerable state and which is facing challenges, the major challenges, youth suicide. And in India, Puducherry is in the highest vulnerable zone. Puducherry is a city which is situated in the southern east part of India, and Puducherry tops the national suicide rate. Especially, it even secures 3 times and 4 times higher than the national average of in Indian suicide ratio. And Puducherry Youth Helpline, it's actually first ever youth hotline in India. It is a confidential, non-judgmental virtual space for young people. It's a space for youth feelings. It is dedicated to address psychosocial determinants of youth suicide, also economic aspects as well. Some of the major services that we are providing through Youth Helpline for a long time is that we always focus on a positive mental health through Youth Helpline. We are providing youth mental health counseling through the Youth Helpline to address most of the psychological factors, and we provide job assistance to address the unemployment crisis, and career guidance, education loan supports, and fellowships to address the education and the experience lackings and challenges. Also, we also provide entrepreneurship guidance to make the youngsters self-sustainable in Puducherry and around here. And all these services are being provided with by the professional psychologists and social workers and some of the partner organizations from the government and the public and private stakeholders. And after the COVID-19 pandemic, it has created a lot of chaos. It's been a very chaotic situation in India, especially in Puducherry and regions around. And since we are working with young people and their mental health, we had received a lot of mental health calls, and we had received a lot of counseling requests in which we had found out that not only the mental health issues and some of the mood determinants are the contributing factors for their mental health issues. Majorly their socio and the economic factors are contributing majorly for their mental health issues, which are their poverty, their hopelessness, and their financial struggles are contributing a lot in the COVID pandemic time especially. And the lockdown has made most of the people unemployed, and that has created a huge impact in youth mental health and the overall mental health of people over here. So TYCL has initiated this initiative named Overcome COVID-19, and we had created even a virtual space a website named Overcome COVID-19.in. Through that, TYCL has been providing virtual creative expression spaces for youth and children to enhance their mental health and engage them in a positive way in the lockdown period. And non medical support has been provided through COVID-19 hotline in Puducherry as well. In the first wave, nearly 1,500 families got benefited in the first wave of COVID-19, and and we had took lot of learnings in the first wave, and in the second wave, we had we could have we could witness a lot of mental health crisis, and the major contributing factors for the mental health crisis were poverty and the lack of money and the lack of revenue generating models in models. So TYCL has initiated a model to address those challenges which are contributing for their for the youth mental health. So we had provided model isolation center support in the local government. There are some challenges, and the people over here couldn't get the basic isolation center supports if they are not having any amenities or facilities. So we had provided more than 14 beneficiaries isolations and quarantine support, and for more than 1,000 families, we could support them with the grocery kit provisions, and food and medicine supplies were given to the quarantine people, and extended mental health support regardless of time has been provided for the people in risk. And we had also crowdfunded and donated to the local government for fixing the oxygen bed facilities to fix the lackings and challenges. And more than 1,200 families got benefited in the second wave of COVID-19 directly, and indirectly there were a lot more people got benefited through our services. All these services is totally meant to spread love and care, to build a collective resilience and mental health through our support system. And these are all the some of the services that we had done in the COVID lockdown situations. And it's been a tougher time, but still the group of young people had joined their hands, and they had supported to bring back the resilience in the community, and the community actions by the young volunteers were really appreciated. And these are all the works that we did, and maybe similar recommendations and similar ideas are being appreciated for the government as well. And maybe for in the recommendation part, as other high income countries, maybe in India can also have a national youth specific national youth mental health policy to discuss and to advocate about youth mental health, to take care of the mental health of young people, and a specific action plan for youth mental health of India. Also, I would recommend as a representative of major youth in India, I would recommend National Youth Hotline in India to address most of the socio-economic challenges and suicide determinants in India. Also, to do all these things and to make things run effectively, maybe I would strongly suggest allocate some specific budget for youth mental health program in India. So all these if all these recommendations come to practice, the above said, according to WHO, the above said $1 trillion US could be saved. And with this, I am ending my presentation here with one of the Tirukural, like that is a literature in Tamil, which says, "Noi nadi, noi mudal nadi, like noi nadi, noi mudal nadi, adu tanippa vai nadi vaipache," which means finding out the root causes and addressing it will do the justice, like instead of like just focusing on the symptoms. So we can like apply it on most of our life even. So maybe like if we are finding the suicides and mental health challenges as a disease, then like we can think about the root causes, and we can think about addressing those issues, which is the psycho-socio-economical issues in India. So I will strongly suggest that with the Tirukural, and I am ending my presentation here. And thank you for the awesome like platform to share and represent Indian youth in this highly privileged event. And thank you so much.
Thank you, Mr. Rasaiya. I do agree that in order for us to solve the issue, we need to address the root causes. Okay, so now it's our turn to welcome our last speaker for today's side event. She is a French-Canadian student currently enrolled in an International Master of Public Health program at the French National School of Public Health, Ms. Julie Gagnon. So Ms. Julie Gagnon is also a project officer at the French WHO Collaborating Center on Mental Health in light of the WHO Quality Rights Initiative to improve human rights condition and person-centered recovery approaches in mental health care systems. Her current research project hopes to quantify mental health policy prioritization in UN member states, government budget allocation to health, specifically mental health, and to identify local and grassroots organizations or NGOs internationally with the objective of participating in expanding the civil society mental health advocacy network. So Ms. Gagnon, thank you for joining us today, and you may present now.
Thank you, Karthika, for the presentation, and thank you, Dr. Siva, also for the opportunity to present today during this this panel. So I'll just start by sharing my screen. All right, can you all see my screen?
Yes, we can see it.
Perfect, thank you. So before I get started, I just want to recognize that my perspective is one from a Western country and from the Northern Hemisphere, so to keep that in mind. So just to start, before I dive into the research project, just going to look a bit at the global prevalence of mental health disorders. So globally, there's 15% of the global population that has mental health disorders. So this represents about 970 million people globally. And as we can see, anxiety disorders are the most common mental health disorders, with almost 4% of the population globally suffering from anxiety. The global burden of mental health disorders in terms of depression, it has moved from 4th in 1990 to 2nd in 2020, and self-inflicted injuries are the 14th, ranked 14th in the global of the top 15 burden of disease. And it's also been recognized that by 2030, mental health disorders will account for more than half of the global economic burden attributable to non-communicable diseases. Yet economic disadvantage is associated with a greater likelihood of mental illness. So either due to higher exposure to risk factors or lesser access to protective factors. In terms of youth mental health, it's already been stated, but suicide is the second leading cause of death for 15 to 24-year-olds. Half of mental health disorders do start before the age of 14, and 1 in 7 adolescents experience mental health conditions, which is an increase of which means that globally 175 million adolescents suffer from mental health disorders, which is an increase of 4 million since 2000. So here I've listed a few global action programs. Obviously there's a lot more civil society programs also that occur. I'll skip slides just in terms of time-saving purposes. So in order of our research project, the objective as stated by Siva and Karthika during the introduction is really to gather data on the prioritization of mental health policies and programs of UN member states. And this is to pinpoint which regions have scarce mental health prioritization to expand international collaboration and advocacy. So how do we do this? Well, we have a sample of 66 countries, and this sample was determined by using systematic sampling using multi-layered clustering. And our first cluster was in terms of income classification of countries, and the second cluster in relation to the UN regions of member states. The research itself is divided into 3 steps. So today I'll be presenting mostly the first step, which is the classification system of the prioritization of mental health within the voluntary national reviews of the Sustainable Development Goals that are done by each country. So what's our classification system? Well, the first classification is mental health prioritized, where countries clearly allocate budget to mental health initiatives and programs, and it's discussed in detail in the voluntary national review. When mental health is simply mentioned, the suicide rate, which is the indicator of the SDG 3.4, is when this is mentioned, it's considered mental health mentioned. And if there's also let's say just one national mental health policy or legislation, but it doesn't detail how it's supported, then it also falls into this classification. And lastly, it's mental health not mentioned. So when it's not mentioned in the VNR, then it falls under this, this classification. Our in-depth country profiles are more detailed. They go into budget allocation of mental health initiatives and also mental health care and psychiatry. And finally, the third step is to identify local actors in each country to be able to network and use local actors to advocate for mental health. All right, so our results, we have finished 52 countries of the 66 countries in our sample. Of these, 21% prioritized mental health, which were mostly high-income countries. 39% mentioned mental health in their VNRs, but did not prioritize it. And lastly, half of the countries do not even mention mental health in their national voluntary reviews. And when looking at the global south, as we can see, four countries, so 11% of our sample prioritized mental health, 34% mentioned mental health, and over half of the countries did not mention mental health in their voluntary national reviews. Just as a note, out of the 52 countries that we did research, 35 are from the global south. So now we're going to take a look at 3 examples of country profiles of country profiles. There you go. So the first one is Panama. Panama did prioritize mental health in their voluntary national review. It clearly reported the suicide rate, its incidence, and its trends over the last few years, and it has put effort into the development of health promotion programs, including mental health and drug and alcohol consumption reduction. It has increased its investment also in telehealth, and including the development of mental health tools and applications for its citizens. In terms of health budget allocation, the priority of Panama is really environmental health, with 57% 57% of its budget allocated to this purpose. Yet no information is clearly given on mental health or psychiatry budget allocation within its resources. Lastly, for local actions, please excuse my Spanish, but the Asociación Nacional de Familiares, Amigos y Personas con Esquizofrenia. I've taken about 30 hours of Spanish, so that's about it. Is an association for family and friends of people living with schizophrenia in Panama. And there's also a campaign, No Estás Solo, that was that raises awareness on mental health dialogue, specifically in youth. And then I put a little note also that this demonstrates that even though mental health can be prioritized in the Sustainable Development Goals, VNRs, it doesn't necessarily mean that governments follow in terms of health budget allocation, which is why we need to have the second step of the research in order to really be able to advocate for governments to allocate budgets towards mental health. Second, Nepal. Nepal had mental health mentioned. It reported its suicide rates. However, most of the health outcomes focus on decreasing rates of child and maternal mortality. They do have budget allocated to mental health promotion. This budget is allocated though on local level to have community interventions. However, within the sources that was found, the number or the percentage of this budget was not included, so I cannot give you numbers. A few examples of local actions: the Shahari Nepal for Mental Health, for example, is a non-for-profit organization that helps people living in a situation of homelessness that may need mental health support. And lastly, Sierra Leone did not consider mental health in their voluntary national review. Their voluntary national review focused on education and justice, and looking at Sustainable Goal 3, which is good health and well-being. There was really just a tiny paragraph on health. So within this, they mentioned that they did increase spending in the public sector, specifically public health budget allocation, but this goes towards national emergency medical services, social health insurance, among other sources. And mental health was not mentioned once in their voluntary national review. For their budgets, it really focuses on the salary and training of health workers, on the National HIV/AIDS Program and Commission, and on medical supplies. And lastly, just examples of local action. Well, the Well Body Alliance is a non-for-profit organization that offers healthcare as a human right, and this includes mental health, and it's offered by community healthcare workers that go out into communities. In terms of study limitations right now, we're really dealing with language barriers, specifically in terms of government sources to determine budget allocation. So right now the research team can only assure English and French translations. Well, I guess English doesn't need to be translated, but French translations of government sources. So finally, I just put a little note on local actions and advocacy, that it's important to prepare, to strategize, and to communicate our goals, and to really involve a multitude of stakeholders and collaborate on all levels. So now I am finished my presentation. I hope it leaves times for questions and discussion. I think I went a little fast, but that way hopefully we can discuss. And thank you for your time and attention.
Thank you so much. Okay, everyone, now we are having our session for question and answer. I would like to give the opportunity to anyone here, any participants who wants to just maybe unmute themselves and ask questions to our speakers. Or if you're uncomfortable speaking on cam, you can also drop your question in the comment section. Okay. Ms. Radhika.
Yeah, hi. I have a question for Professor Carolina Giraldo. In her presentation, she talked about using arts and sports as a strategy to address mental health. Could you, Professor, tell us a little bit more about what was done in terms of arts and sports intervention? What kind of interventions? How art was used and sports?
Professor Giraldo, are you still here with us?
Are you there?
Hello, can you hear me?
Yes.
Okay.
Yes, we can hear you. Did
Okay,
you hear
thank
the
you.
question?
Yes, I understand the question, and thank you for this. The young people say in this conversatory that they need more invest in sports like community and local initiatives that could be very supported by the in public institutions, of course, that it's very important that the arts and the sports can be a strategy for the attend the mental health issues. And we think that it's important that maybe in this kind of scenario, or we can talk about it because we need to invest more in this kind of programs in the neighborhoods, in the different places. And of course, they invest in the sports. It's very important because here, when champion, it's very important in the newspaper. You say, oh, it's the representation of your country. But when you look the reality, this person have a lot of efforts alone or with his family or with her family, but not a really support for the government. And maybe this is that the young people is asking.
Professor Radhika, some of the creative arts has been, there are several studies has proven that like a creative arts is the most effective tool to address the mental health issues, particularly stress, anxiety, and depression. So one of the program even TYCL India as well as TYCL International have done, and I just shared in the chat box that there's a like online program where we do like there's a module. We have like two different modules. One we have developed, one we are in the process of developing, one for creative arts for positive mental health, where the young people can go through it's a 5-day module for in-person program. You can like take a pre-test of what's your level of your stress, anxiety, and depression before you're taking it, and then post-test, and we measure the how impactful the creative arts to heal their mental health challenges. So that's something which we've been trying and experimenting it, and also we are building. We realized that very recently we had experience that when we had this discussion with young people, what is like a most pressing issue you've been undergoing? One of the kids came up and said that the racism in the US, and similarly we do notice the issues like the caste-based discrimination and discrimination at the school level, and because of their hygiene, and then where they're coming from, gender. There's a lot of social determinants also causing mental health issues among the young people. How do they express those things in the creative arts, and what are the different art forms can be used to express and try to build their resilience capacity? So that's how it's been like there is a plenty of study which has been proven to be more effective with the mental health. We are also continue to study on that with a different region. So we have tried in India and the US, and then we are expanding that work to the other parts, particularly in the Africa and South America.
Thank you so much, Mr. Siva and Professor Giraldo. Thank you.
Thank you. So our next question is to Ms. Gagnon. So one is from Aruna asking about to what extent your review of the documents that you reviewed leave out local interventions like traditional or spiritual healing, community support mechanism, and such. And then the second question also to you is from Karen. How do you think low-income countries will be able to focus on mental health more?
Thank you for your question. So to answer the first questions, Mr. Rahman's question, a lot of voluntary national reviews do leave out community involvement and spiritual healing. However, there are some examples like Nepal's VNR who specifically do allocate budget for community support. And so it is there in some voluntary national reviews, but I'd say that, yes, I do have Australia that has allocated a lot of budget specifically to Indigenous communities to support mental health initiatives in their communities. However, that is one example that I've had, and also Nepal. To answer the second question from Karen, I recently participated in a conference that involved mental health in Africa. And so, to quote these experiences, many of these communities expressed that through training of healthcare workers and community outreach, mental health can be addressed. And also to bring back the arts, Shiva, there was one community program that used the arts and theater in community outreach to sensitize and bring awareness to mental health disorders and epilepsy. And so this can be one also strategy to bring awareness and in mental health in low-income countries. Does that answer your questions?
Yeah.
I think yes.
I think yes.
Okay.
In addition, if you need more information on this, like it's been ongoing research which we are continue to work on that. Particularly, I know translating the work which we have been doing, it's more of a macro level, and trying to review. Most of the countries coming with the national reviews are like won't really discuss much about the like a grassroots level initiatives. So they do like highlight the programs, but that's something's a gap which we've been emphasizing, that try to bring like a more grassroots practices into your reports, how more detailed informations can be helpful. But that's why we are trying to look at like more of a shadow reports also, so that like NGOs, particularly international NGOs and the national NGOs, are trying to bring the shadow reports to the UN, like then try to match between the like national reviews and then shadow reviews by the organizations, where we can identify more indigenous healing practices. So more indigenous healing practices can be identified by the NGOs report, not by the government report. There's like some kind of, we do aware that the need for fusioning or hybrid version of healing practices comes from the indigenous healing practices from our own communities, and the modern the psychosocial healing practices coming from the modern medicines has to go together. So that's how, like even like in India, they've been experimenting a lot, as well as in Africa, they're experimenting a lot, but there's a lot of challenges in terms of putting that in a scientific language and how we communicate that in a very efficient way. Even today, we've been facing the challenges of Professor Susan, like Dr. Susan can't join today just because of power cut. There is no power in Kenya, and she can't join today. And that's a kind of a challenge we've been facing in terms of identifying the needs and identifying the best practices from the local communities and translating them into the international platforms. It's been a challenge. I think hopefully when we start, there's a lot of practitioners and professionals are here. If you could go ahead and then wherever you're working and document that in a much more in a systematic way and presenting it in a international platforms, that might create a lot more empirical evidences for indigenous practices. That will help us to even compile and then present it and advocate it much more stronger and louder. And thanks. And Aruna is like raising a question or raising hands. Yes, Aruna, over to you.
Yeah, thank you for answering in sort of a sideways answer to Karen's question, and also presenting my positionality. I'm a person with lived experience of mental illness. I've had GAD for 25 years, and I'm also, creating a profile as a mental health communicator, someone who studies all aspects, either scientific or justice narratives, grassroots narratives, and kind of brings them together. So it's not, I would say that it's not that low-income countries don't focus on mental health. They just don't focus on it as demanded by the colonial model, English-speaking model of mental health, right? So if you look at the vocabulary of local languages like Tamil, Kannada, or Hindi, there is no direct translation for words like depression, anxiety, schizophrenia. We say chinta or tanav or, kavalai or things like that. But how do you put that in a report to an international organization? The bridge needs to be built on both sides, really. So you really need to identify intermediaries who both speak those local languages, but also have some experience to, act as conduits to bring these stories to the forefront. So it's just that because we are determined so much by this colonial model of presenting or articulating, it feels like there is no focus. The focus exists even in the form of discrimination, right? And one space where I have done a lot of my learning, believe it or not, has been on social media. I mean, there are wonderful practitioners on Instagram, both trained mental health professionals, people with lived experience, at least from the Indian context, who live in tier 2, tier 3 cities, who are doing content in Hindi, who are doing, who come from specific communities that are not represented in the mental health intersectionality narrative. So it's not just about imposing a certain lens, but also flipping the lens and becoming more creative about where you find your information, basically. Thank you.
Thank you. Thank you very much for sharing. And also you posted a question in the chat box about how, specifically to Rasaiya from TYCL, how do you actually engage people with lived experiences living with mental health to play a role in the initiatives that you have to address mental health?
So before we address that, I would like, go to Julie and take the questions, running out of time too.
Sure.
Thanks, Shiva. It was just in a response to what Aruna said. I wonder how local governments can come into contact with communities, with more rural communities that may share the same language, yet could bring the information on a more international or national level. I wonder what type of horizontal collaboration could happen in order for a common language to be developed and bring this grassroots community involvement in mental health forward. This is an open question to anyone who might have thoughts on this.
I'll go with the Rasaiya, then we'll take that up.
Thank you, Rasaiya. You may answer my question.
Okay. So you are also saying the Aruna's question, right?
Yes.
Yeah. Okay. Like we had already envisioned it, and we in the sense TYCL usually claims TYCL as a platform which is safe, inclusive, and participative for anyone over here. So it would be a safe, inclusive, and participative space for anyone, irrespective of any of their identities, as long as they are ready to come and support and lead our programs. And we are so happy if any of the people who have lived experience of mental illness are ready to support us, and there are people who have been having lived experiences in the past are also supporting us in our current mental health programs. Also, with our some of our partner organizations, we are also working directly with mild and moderate people who are having some of the mental illnesses. And shortly answering the question, yes, we have envisioned and we are ready to, and we are already doing it. Thank you.
Thank you. Dr. Siva, do you want to continue? But our time is very limited, so it would be nice if you can keep it short. Thank you.
There are two things. One, I want to mention about, I'm just going back to my own way of, like my own lived experiences in terms of how I've been observing Opari as one of the most effective tool for healing the grief and losses, and that's just one of the most traditional form of expressions the people do it. So when we have this kind of a traditional indigenous practices for our own collective healing of mental health challenges, particularly processing your own grief and losses, and that's where like we normally won't really, there's a like a informal community support is available to process your loss and grief within the community. So that's part of the culture. When you go and seek your external support for mental health issues, then it's become a reporter or underreported, or it get noticed. So when you offer a support within the community, for example, even in the recent COVID surge in India, the neighbors and relatives are step up and then came and supported them one another. And that's not get noticed. When some third parties coming up and organizations are coming up, that get noticed and getting recognized by the mainstream media or by the government. So that's getting reported. So something is happening at the community level, it's not done. So I think the major work would be like, identifying some of our own indigenous healing practices like Opari, or sometimes here they in the US context they use rap as one of the major way of expressing their grief and loss. That's a most creative expressions for mental health healing. And similarly, there we have a Ghana, Natupura Patu, or like our Opari, use like any kind of traditional art forms or our own indigenous art forms can be used as a tool too. And the most important work for us as a younger generation to document those art forms and how that art forms are effectively impacting on the people at local level. Even if it is at a grassroots level, then we need to, compile that I think it's not really a difficult task to even translate it into any language. You always, when I'm particularly documenting those work, I always use like alternate vocabulary for that and put like the local language in the bracket. So you learn our local language or like use my alternate word, whatever I'm using it. So that's how we somehow we need to work around that area. In terms of using people with lived experiences in our own projects, particularly in TYCL-India projects, I think people like who have attempted the suicide and then coming forward and advocating for our projects and are promoting for positive mental health. That's something which we have been practicing, and we try to, our youth helpline receives on an average of 250 calls a year of whoever having like a mental health issues. So those 250 people, at least 10 to 15% of them are coming forward and helping us out. Similarly, we are also expanding our work into the rural mental health clinics. So people are like going into the community and sensitizing and taking them, if they are willing, the community is coming forward and supporting because they have lived experiences of mental health challenges and they're extending their support. There are plenty of ways people can engage in their using their lived experience as an opportunity to support others and join in the healing practices.
Thank you. So I think our time is running out. So
Oh.
before we wrap up, I would like to invite Mr. Dawood Mayom, a Master of Social Work student at Columbia University, who is also a graduate student intern at TYCL. He's now calling in from Egypt and will deliver today's closing remarks. So please welcome Mr. Dawood Mayom.
Thank you, Karthika. Can you hear me?
Yes, we can hear
Yeah,
you.
okay. Good day, everybody. Good afternoon, good morning, good evening, depending where your location. I'm really glad to be here today with the great speakers. I would like to thank everybody for making this a such meaningful side event during 2021 high-level political forum. Of course, all good things must come to an end, and now our event comes to reach the point to conclude here. And therefore, I would like also to send my gratitude to the panelists for providing such rich and insightful information and discussions. I would like also to thank our attendees for registering and dedicating time from your busy schedule and to attend this event and participate in very active and interactive manner. So thank you, all of you, and thank you for the organizer team. We together work tirelessly to ensure this event takes place. And thank you for your time and your work. In particular, I would like to thank Dr. Siva and the team in India. You guys were very awesome working on this, this side event. To me, this has been really a fantastic event. I've been paying close attention to speech and to many points that has been raised during the presentation. I couldn't agree with you more on this in general, but I would like to conclude by emphasizing the importance of youth mental health. And as we know, COVID-19 has revealed the importance of all of us working together to support the global mental health resources for youth mental health and recovery, in particular in Global South. All of us as scientists, scholars, policymakers, change makers, activists, advocates, and donors, we need to work together and make this effort happen. And this would almost certainly result in an expansion of mental health services, and would also, I also believe this would also expand the availability of mental health services for youth in low and middle income countries. So without doubt, they are the future of this region in Global South. I believe also we should pay more attention to and support mental health activities and programs. And I think we must continue such a discussion on youth mental health and find out interventions that need support. And then from there, we can see and advocate for allocation of resources, development of active national policies that address pandemic and its mental health consequences on young people. By doing so, we can see the change that we want to see. Finally, I would like also to you to consider this question: what ways and how best can we support youth and mental health recovery in Global South? Without further ado, I would like to return it back to Karthika, the moderator, and give you thanks for moderating this event. And thank you for everybody who attended today.
Thank you, Dawood. So unfortunately, our time is up now. I know that the discussion has been really insightful, and if any participants or speakers wish to connect with each other, I see some networking is already happening in the chat box. So if you want to connect to each other after this, you can just stay. We will leave this Zoom meeting on for you to reach out to each other. On behalf of TYCL, I would also like to thank our participants today for actively participating and for updates on our virtual events or webinars. You can follow our social media. I'm sharing the social media handles to you in the chat box. And after this, before I wrap up, there will be a video from Professor Giraldo about youth participation in the initiative that they do. And I'm Karthika on behalf of TYCL. I would like to thank you again, and we hope to see you soon. Thank you.